Mechanical injuries of brain and meninges. 1. Traumatic lesions. 2. Alterations. 1. Traumatic lesions. Extracerebral lesions. Intracerebral lesions. 1. Traumatic lesions. Close injury. Open injury. Extracerebral lesions. Epidural bleeding. Subdural bleeding. Subarachnoid bleeding. Intraventricular bleeding. Intracerebral lesions. Contusions. Lacerations, or wounds. 2. Alterations, circulatory disorder, necrosis and hemorrhages. Post-traumatic hydrocephalus. Secondary infections. Fat and air embolism. Epidural bleeding. Epidural bleeding. Epidural, extradural. Hemorrhage, hematoma. Causes skull fracture, separation of dura and skull bone. Tear of a dural artery, its branches, and or occasionally of a vein. Most common site, lateral convexity of a cerebral hemisphere. Location, it almost always at the site of a skull fracture. Uncommon, occur in the elderly. Children, skull deformation with separation of the dura from the bone without skull fracture, acute hematoma, artery bleeding. Delayed hematoma, venous bleeding, transient arterial spasm. Progression of the bleeding. Space-occupying hematoma. Increase intracranial pressure. Confusion. Alteration of consciousness. Pupillary dilatation, on the hematoma side. Central respiratory failure. If venous bleeding, or transient arterial spasm, lucid interval. Consciousness, may be, no signs of confusion, occipital pulse and or cerebellum, chronic epidural hematoma. The hematoma spontaneously shrinks and becomes encapsulated by fibrous connective tissue, subdural bleeding. Subdural bleeding, trauma, rupture of aneurysm. Arteriovenous malformation. Vein, tearing of one or several bridging vein. Insignificant trauma, sometime. Abnormally located blood vessels, artery, particularly in branches of the middle cerebral artery. Severe cortical contusions and bleeding. Into subarachnoid space. Usually, tears of arachnoid membrane. Artery. More frequently on the side opposite. The impact may, without brain contusions, or significant subarachnoid hemorrhage. Time of onset acute, within 12 to 24 hours. Subacute, from 24 hours to 7D. Chronic, more than 7D. Most location, over the convexities and the lateral aspects of the cerebral hemisphere. Often, extend over the base of frontal and temporal lobes. Occasionally, between the hemisphere. In skull intact, occur as often as with skull fracture. Rare in the posterior cranial fossa, around the brainstem and cerebellum. Chronic subdural hematoma. Enlargement if untreated. Isotonicity. Local presence of fibrinolytic enzymes, bleeding tendency. Subarachnoid bleeding. Subarachnoid bleeding, trauma, non-trauma. Extension of intraventricular hemorrhage, moderately severe blow to the face or forehead. Sudden, usually severe hyperextension of the head, as from a fall onto the forehead. Subarachnoid over the brainstem and basal systems equals hydrocephalus. forgetfulness, confusion, psychotic state. Spasticity of the lower extremities, intraventricular bleeding. Intraventricular bleeding, most often arterial in origin. Trauma. Non-trauma, such as rupture AVM or aneurysms, intracerebral lesions. Contusions. Lacerations, wounds. Contusions. Contusion hemorrhage. Contusion necrosis. Contusion tear. Intracerebral hematoma. In the deeper portions of contusions, more frequent in the frontal and / temporal lobes. Location: white matter greater than gray matter. Intracerebral hematoma. Secondary rupture into the ventricular system and or the subarachnoid space usually does not occur. Lacerations. Stab wounds. Gunshot wounds. Gunshot wounds shearing forces within brain tissue. Expansile cavitation. Distant contusions, hemorrhages. Contusions according to causative mechanism. Classification of contusions. According to causative mechanism, depending on site and direction of impact. Coup, intermediary coup, contra coup. Independent of site and direction of impact. Fracture contusion, gliding contusion. Herniation contusion. Axonal injury shearing forces due to blunt head injuries. Focal, diffuse. Early, the areas, little or no change on gross examination of the white matter. Older lesions, slightly gray pallor. 2 alterations. 2 alterations: circulatory disorder, necrosis and hemorrhages. Post-traumatic hydrocephalus. Secondary infections. Fat and air embolism. Circulatory disorder, swelling of the brain, edema and cell necrosis. Usually reversible. Perifocal, surrounding a one brain lesion. Generalize, a primary lesion, shock. Other rare causes: obstruction of the superior sagittal sinus. Traumatic thrombus or obstruction in internal carotid artery. Necrosis/hemorrhages. Vascular compression. Shearing lesions. Necrosis/hemorrhages. Many lesions are large, such as midbrain and pons. If rapidly progressing space-occupying lesion, secondary lesion may appear within 30 minutes after injury. Hemorrhage, sometimes small or absent. Hydrocephalus, traumatic or non-traumatic course. White matter loss following a shearing lesion and degeneration of myelinated axons. Distension of ventricles by elevated pressure of the CSF. Secondary infections. Meningitis. Intracerebral abscesses. Meningitis, an infected open injury caused by a foreign body. A fracture in the wall of one of the cranial sinuses associated with a tear in the dura and arachnoid. Intracerebral abscesses. In the vicinity of the primary lesion. Complication, rupture into the underlying ventricle, pyocephalus.